ओंटारियो के प्रीमियर डगफोर्ड ने कहा कि प्रोविंस अंतर सेहत प्रणाली ਨੂੰ लागू ਕਰਨ ਲਈ कुछ ਤਬਦੀਲੀਆਂ लागू ਕੀਤੀਆਂ ਜਾ ਰਹੀਆਂ ਹਨ। ਉਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਇਹ ਪਲਾਨ ਸਾਰੇ ਮਾਪਦੰਡ ਕਲੀਅਰ ਕੀਤੇ ਜਾਣਗੇ। ਉਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਕੋਵਿਡ-19 ਰਿਸਪੌਂਸ ਲਈ ਹਰੇਕ ਡਾਟਾ ਹਰੇਕ ਫਰੇਮਵਰਕ ਮੁਹੱਈਆ ਕਰਵਾਏ ਜਾਣਗੇ। ਇਹ ਫਰੇਮਵਰਕ ਚੀਫ ਮੈਡੀਕਲ ਅਧਿਕਾਰੀ ਦੀ ਨਿਗਰਾਨੀ ਹੇਠ ਹੋਣਗੇ।
As a province and as a country, we're grappling with a new reality. And it's becoming more and more clear that COVID-19 will be with us for a while. It's why we remain vigilant. It's why we continue to adapt. We continue to plan for the long game. And today, we're taking an important step forward. We're implementing an early warning system with clear criteria to help inform when restrictions should be tightened or loosened on a regional basis. We're giving you a clear understanding of where you are as a region, because I know that you want access to more data. I know you want predictability. Today, we're releasing our province's COVID-19 response framework. This framework was developed in consultation with the Chief Medical Officer of Health, the Public Health Measures Table, local medical officers of health, and other health system experts. This planning framework provides structure. It will help inform decisions on a regional and province-wide public health measures based on the data we're seeing. The framework will also provide more certainty to businesses, families, and workers. It will help us introduce preventative measures early to slow the spread, early interventions that will help us avoid more restrictive measures like the shutdowns and lockdowns we're now seeing in more and more countries around the world. It takes a gradual approach to public health measures, cautiously escalating or reducing restrictions as we see changes in the local data. We will stay on top of the trends to determine where regions stand. And thanks to the revised framework, we can start to transition regions away from modified stage 2 restrictions, which were always intended as short-term measures. Based on current trends and the advice of the Chief Medical Officer of Health, we're prepared as of Saturday, November the 7th at 12:01 a.m. to move Ottawa, Peel, and York region to restrict level. This means gyms and indoor dining will be open with the capacity limits and restricted hours. Mayor Tory has asked us for a little more time in Toronto, and as always, I will support him. At Mayor Tory and Dr. DeVilla's request, Toronto will move to the restrict level a week later on November the 14th. Eastern Ontario will also be moved into restrict level to address concerning trends. Brant, Durham, Halton, and Hamilton will be moved into the protect level as we add preventative measures to slow the spread of COVID-19 and keep these regions from needing more restrictions. All other regions will adopt the prevent level. Our health experts are still reviewing the data and will confirm the alert level for each region on Friday. We're going to continue to provide regular updates each week. And thanks to Minister Bethenfalvey, we have a brand new dashboard on COVID-19 website to provide that important information. This brand new dashboard, it's great news. It will allow you to see exactly where the trends are going. You will have the access to the exact same public health data and information as I do. And I want you to see what I see. This information will be updated daily. It will give you a direct line of sight into hospital beds, ICU capacity.
Our government has not wavered from our commitment to make the health and safety of Ontarians our #1 priority. We've had to make decisions, often very difficult ones, that profoundly affect people's lives. With severe lockdown measures being imposed across the world, we are now at a pivotal point in the pandemic. We know that this crisis is going to continue on, so we need to assess our actions to date and adjust how we make decisions moving forward. Our COVID-19 response framework was developed in consultation with the Chief Medical Officer of Health, the Public Health Measures Table, local medical officers of health, and other health experts. The Keeping Ontario Safe and Open framework ensures that public health measures are targeted, incremental and responsive. It takes a scalable, gradual approach that includes introducing less invasive preventative measures earlier to help limit the spread of transmission and avoid broader closures. This approach is also targeted, with each level having measures for specific sectors, institutions, and other settings. At its heart, this framework takes a comprehensive whole-of-government approach and lays out how we can act earlier by implementing measures to protect public health and prevent future closures. This includes testing, case and contact management, compliance and enforcement, scalable public health measures, and supports to affected individuals and businesses. All of these measures will be essential to limit the severity of the second wave. Implementing select targeted measures earlier will help reduce COVID-19 transmission and prevent significant economic impacts and job losses by avoiding full lockdowns. Enhancements are also being made to our website for information on COVID-19 to inform and engage Ontarians on the status of the virus in each region of the province. We are continuing to expand access to real-time data. Information about local spread of COVID-19, public health and health system capacity will now be available on ontario.ca/coronavirus. This includes local cases by public health unit regions, the total number of cases, resolved cases, deaths, as well as tests completed and how many are positive. This information will help to better support businesses, organizations, and local communities, allowing them to prepare in advance for any changes in their region. We are committed to being transparent with Ontarians, businesses, and local communities as we continue to work together on our shared goal of stopping the spread of COVID-19. I once again want to encourage everyone to please maintain physical distancing, wash your hands thoroughly and regularly, wear a face covering when physical distancing is a challenge or where mandatory to do so, and stay at home when you aren't feeling well. By following this simple advice, we can protect one another and reduce the spread of COVID-19. Thank you, and I'll now pass it over to Dr. Williams.
ਓਨਟਾਰੀਓ ਦੇ ਚੀਫ ਮੈਡੀਕਲ ਅਧਿਕਾਰੀ ਡਾਕਟਰ ਡੇਵਿਡ ਵਿਲੀਅਮ ਨੇ ਦੱਸਿਆ ਕਿ ਕੋਵਿਡ-19 ਰਿਸਪੌਂਸ ਦੇ ਫਰੇਮਵਰਕ ਤੇ ਕੰਮ ਕੀਤਾ ਜਾ ਰਿਹਾ ਹੈ। ਉਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਇਸ ਰਾਹੀਂ ਪ੍ਰੋਵਿੰਸ ਦੇ ਹਰੇਕ ਖੇਤਰ 'ਚ ਇਸ ਦੇ ਮੈਜ਼ਰਮੈਂਟ ਕੀਤੇ ਜਾਣਗੇ। ਇਸ ਦੀ ਨਵੀਂ ਪ੍ਰਣਾਲੀ ਤਹਿਤ ਓਟਾਵਾ, ਪੀਲ ਅਤੇ ਯਾਰਕ ਖੇਤਰ ਵਿੱਚ ਖਾਸ ਕਰਕੇ ਮਾਪਦੰਡ ਤੈਅ ਕੀਤੇ ਜਾਣਗੇ।
Minister, good afternoon. The COVID-19 response framework lays out a proactive and graduated response to the situation in each region of the province. This means that additional measures and restrictions will be applied in higher risk settings based on the severity of disease transmission in a region. As the pandemic has progressed, we have learned more about COVID-19 and how it spreads. Our public health measures, including physical distancing, people staying home when ill, even with mild symptoms, and limiting the number of people that come together, are all intended to reduce our number of close contacts. We know that there are other measures that can further reduce the risk of transmission, minimize the impact of super spreader events, support compliance with the rules, and make case and contact tracing easier. The COVID-19 response framework includes these additional measures. This framework lays out a proactive and graduated response to the situation in each region of the province. This means that additional measures and restrictions will be applied in higher risk settings based on the severity of disease transmission in a region. As the pandemic has progressed, we have learned more about COVID-19 and how it spreads. Our public health measures, including physical distancing, people staying home when ill, even with mild symptoms, and limiting the number of people that come together, are all intended to reduce our number of close contacts. We know that there are other measures that can further reduce the risk of transmission, minimize the impact of super spreader events, support compliance with the rules, and make case and contact tracing easier. The COVID-19 response framework includes these additional measures that allow businesses and other settings to operate while working to limit spread. It also implements select targeted measures to help avoid closures and full lockdowns. While closures are sometimes necessary to interrupt the transmission of COVID-19, we recognize their harms, including to people's income, employment, and well-being. As a public health physician, I know that these are important determinants of health and need to be considered in our response. We also experience the challenge of school and child care closures and restrictions in long-term care homes in the spring. We know that those actions had an impact on the mental health and well-being of children, seniors, caregivers, and our communities. Avoiding the need for these types of closures is critically important. This can only be done if the public health measures and restrictions are complied with, both by individuals and businesses. And while it's important to support local businesses, we need everyone to recognize that risks remain, especially in crowded places, in enclosed spaces, and where there is close contact. That is why people should continue to follow public health advice and limit close contact to individuals in their household and even in public settings. We, as individuals, families, and businesses, all have our role in keeping each other safe. I will now pass things over to Minister Phillips.
Thank you very much, Dr. Williams, and thank you to you and your whole team for all the great work that you've been doing on behalf of the province. On Thursday, as you may have heard, we'll be releasing our 2020 Ontario budget, the next phase of Ontario's action plan. It'll provide a multi-year outlook that builds on the $30 billion response to COVID-19 that we first outlined on March 25th. Recognizing, as families and businesses do, that especially during this period of uncertainty, it's important that we have thoughtful plans. The next phase of Ontario's action plan will make available every resource that is necessary to continue to protect people's health, and it will expand on the support our government has been providing for those still facing financial hardship as a result of the pandemic, including families, workers, vulnerable people, seniors, and employers. The plan will have 3 pillars, and yesterday we announced the first pillar, Protect, which is making good on Premier Ford's commitment to the people of Ontario to do whatever it takes to get through the pandemic. The second pillar is Support, because we know that COVID-19 has brought severe challenges and economic difficulties to families and employers. Since the beginning, we've promised to be there for those who are struggling most, and my budget on this Thursday will outline our plan to build on the initial response to COVID-19, including the $13.5 billion of direct support for people and jobs and $11.3 billion in cash flow relief. That's money that will support seniors, vulnerable people, parents, workers, and small business owners. Now, in addition to the news we have today, the important news about the public health approach, there's also other news we want to speak to you about the vital part of the support pillar, which is the $300 million we're making available to assist businesses impacted by the difficult but necessary decisions to impose new public health restrictions. This applies to businesses significantly affected in modified stage 2, specifically in Toronto, Ottawa, Peel, and York region, as well as in the control and lockdown levels outlined in today's framework. Today, we are sharing the details about how businesses can access this financial support. Beginning November 16th, businesses will be able to apply online for property tax and energy cost rebates. Reimbursements for these costs will start to arrive this month. Those employers will have their bills covered for the entire time these necessary restrictions apply. They will be able to apply directly to the province through a single online portal. These businesses can expect to receive their rebate payments within a few weeks from the date they submit their completed applications. All they will need is their property tax bills and their energy bills, including electricity, natural gas, heating oil, and propane. Small business owners have enough on their minds right now, so the application process will be straightforward. If the public health restrictions are extended, businesses would be eligible for rebates for the next period.
ਕੈਨੇਡਾ ਦੇ ਪ੍ਰਧਾਨ ਮੰਤਰੀ ਜਸਟਿਨ ਟਰੂਡੋ ਨੇ ਐਲਾਨ ਕੀਤਾ ਹੈ ਕਿ ਕੈਨੇਡਾ 'ਚ ਛੋਟੇ ਕਾਰੋਬਾਰਾਂ ਨੂੰ ਅੰਤਰਰਾਸ਼ਟਰੀ ਬਾਜ਼ਾਰਾਂ 'ਚ ਪਹੁੰਚਾਉਣ ਲਈ ਕੈਨਕਸ ਸਪੋਰਟ ਪ੍ਰੋਗਰਾਮ ਦੀ ਸ਼ੁਰੂਆਤ ਕੀਤੀ ਜਾ ਰਹੀ ਹੈ। ਉਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਕੋਵਿਡ-19 ਦੇ ਦੌਰ ਤੇ ਹੋਰ ਵੀ ਸਹਾਇਤਾ ਪ੍ਰਦਾਨ ਕੀਤੀ ਜਾਵੇਗੀ। ਇਸ ਤੋਂ ਇਲਾਵਾ ਉਹਨਾਂ ਨੇ $7.5 ਬਿਲੀਅਨ ਦੇਣ ਦਾ ਐਲਾਨ ਵੀ ਕੀਤਾ ਹੈ।
I've been speaking with business owners across the country. And while this virus is no match for their resilience and creativity, I've heard how worried people are about the second wave. So on that front, we're taking yet another step forward. Today, I can announce that the CAN Export Program is pivoting to provide new support for small and medium-sized businesses on e-commerce, online platforms, and virtual trade events. There will also be additional resources to help business owners navigate COVID-19 trade rules and dedicated help for women and Indigenous entrepreneurs. Many small businesses have been able to stay open because they moved online. We want to grow that potential. Not only is this a great way to make sure that local shops can keep serving their neighbors, it's an opportunity to expand into global markets and rebuild a strong, resilient economy when the Canada brand is strong. I want to end this morning by offering my deepest condolences to the family, friends, and CAF colleagues of Corporal James Choi, who we tragically lost over the weekend. We are here for you as you mourn this terrible loss. Those who knew Corporal Choi describe a dedicated, hard-working young man and a natural leader. He will be missed. As we mark the start of Veterans Week this Thursday, we'll have the chance to honor the service and sacrifice of Corporal Choi and of so many others. Our women and men in uniform have stood together in defense of a better world. Let's remember their legacy and do our part to carry it forward. This year, many remembrance commemorations have moved online, so go to veterans.gc.ca/Canada Remembers to join in. You can also pick up a poppy at a box in your neighborhood. They've set things up for touch-free donations, or create a digital version at mypoppy.ca.
ਕੈਨੇਡਾ ਦੀ ਚੀਫ ਮੈਡੀਕਲ ਅਧਿਕਾਰੀ ਡਾਕਟਰ ਥੈਰੇਸਾ ਦਾ ਕਹਿਣਾ ਹੈ ਕਿ ਪਬਲਿਕ ਹੈਲਥ ਏਜੰਸੀ ਹੁਣ ਸਿਫਾਰਿਸ਼ ਕਰ ਰਹੀ ਹੈ ਕਿ ਸਰਦੀਆਂ ਦੇ ਸੀਜ਼ਨ ਵਿੱਚ ਕੋਵਿਡ-19 ਦੇ ਪਸਾਰ ਨੂੰ ਰੋਕਣ ਲਈ 2 ਪਰਤਾਂ ਦੀ ਬਜਾਏ 3 ਪਰਤਾਂ ਵਾਲਾ ਮਾਸਕ ਪਹਿਨਿਆ ਜਾਵੇ। ਉਹਨਾਂ ਨੇ ਕਿਹਾ ਕਿ ਇਸ ਦੀ ਵੀ ਆਸ਼ੰਕਾ ਜਤਾਈ ਜਾ ਰਹੀ ਹੈ ਕਿ ਫਲੂ ਸੀਜ਼ਨ ਦੇ ਦੌਰਾਨ ਕੋਰੋਨਾ ਦਾ ਪ੍ਰਕੋਪ ਹੋਰ ਵੀ ਵੱਧ ਸਕਦਾ ਹੈ।
PCR is the sort of standard, if you like, the gold standard for testing. And so, but, you know, to augment that capacity, antigen testing can be done if, particularly in places where there's not enough access to laboratories. So any kind of rapid point of care test, that's a key attribute. And if you already know there's an outbreak, you can use, I think, an antigen test to support that outbreak response and try and detect individuals who may be part of the cases that need to be isolated. So I think that's useful. Of course, negative tests, depending on your epidemiologic situation, may not tell you a lot. You still have to use public health judgment in those situations as well. But I think antigen testing can supplement the outbreak response. And that long-term care, maybe outbreak and work settings, that's one of the, potential uses. But in general, if you want to have precise diagnostics, then we advocate the use still of the PCR. Not necessarily saying just throw out everything that you have. I think nobody's really studied non-medical masks in the past. So there's been actually more research into different materials, the number of layers, and particularly the fit. And I keep emphasizing the fit is one of the most important things. I see many of people in this room actually has a very good, well-fitted mask. It's pinched at the nose. It fits all around your mouth and your nose. And it has to cover your mouth and your nose. So that's really important. And we already have recommendations on materials for the 2-layer mask. But it's more and more recommendations, even internationally, that adding another layer of what we call a filter layer could add to that protection. So it's an additional layer of protection, particularly if you have high-risk medical conditions and other risk factors. Then adding another layer of protection, I think particularly important right now as we're all moving inside. I think any additional layer of protection we are now recommending. The filter that we are talking about can be inserted into the 2 layers of, if you had cotton, tight weave cotton, it can be inserted in the middle. or there are actually other constructions that will be on our website. For example, one of the kind of filter materials is non-woven polypropylene, which is like an interface. I don't know if people who sew, I don't, but now I've learned about interfacing. That kind of material can be inserted and ironed on, for example, and as part of the construction can then be reused. You can also buy some filters that are available. So this is an additional recommendation just to add another layer of protection. But I have to say that the science of masks has really accelerated during this particular pandemic. So we're just learning again as we go. But I do think that because it's winter, because we
ਪਿਛਲੇ ਦਿਨੀ ਗੁਰਦੁਆਰਾ ਸਿੰਘ ਸਭਾ ਰੈਟਨ ਗੁਰਦੁਆਰਾ ਸਿਆਲਟਲ ਵਿਖੇ ਹੋਈ ਖੂਨੀ ਝੜਪ ਵਿੱਚ ਪੁਲਿਸ ਨੇ 4 ਵਿਅਕਤੀਆਂ ਨੂੰ ਚਾਰਜ ਕੀਤਾ ਹੈ। ਇਨ੍ਹਾਂ ਵਿੱਚ ਕੁਲਜੀਤ ਸਿੰਘ 33 ਸਾਲ, ਹਰਿੰਦਰਬੀਰ ਸਿੰਘ 62 ਸਾਲ, ਮਰਿੰਦਰਪਾਲ ਸਿੰਘ 37 ਸਾਲ, ਇਹ ਤਿੰਨੋਂ ਕੈਂਟ ਦੇ ਵਸਨੀਕ ਹਨ ਅਤੇ ਹਰਭਜਨ ਸਿੰਘ 50 ਸਾਲ ਜਿਹੜਾ ਰੈਟਨ ਦਾ ਵਸਨੀਕ ਹੈ। 18 ਅਕਤੂਬਰ ਨੂੰ ਗੁਰਦੁਆਰਾ ਸਾਹਿਬ ਦੇ ਲੰਗਰ ਹਾਲ ਵਿੱਚ ਹੋਈ ਲੜਾਈ ਵਿੱਚ 5 ਵਿਅਕਤੀ ਜ਼ਖਮੀ ਹੋਏ ਸਨ। ਇਸ ਖੂਨੀ ਝੜਪ ਤੋਂ ਬਾਅਦ ਦੁਨੀਆ ਭਰ ਦੇ ਵਿੱਚ ਇਸ ਦੀ ਨਿੰਦਾ ਕੀਤੀ ਗਈ ਸੀ।
ਸਤਿ ਸ਼੍ਰੀ ਅਕਾਲ। ਪਲੀਜ਼ ਸਾਡੇ ਚੈਨਲ ਸਾਂਝਾ ਪੰਜਾਬ ਨੂੰ ਲਾਈਕ ਤੇ ਸਬਸਕ੍ਰਾਈਬ ਕਰੋ YouTube ਤੇ।